Hi class, I'm going to go over the renal structures from your Lab Unit 4 hit list and, towards the end, the respiratory structures as well. I hope you know by now that this structure is a kidney, and this outer portion that you're seeing here is the renal capsule. So shown here in brown is the renal capsule. And its function is basically to provide containment for the kidney. The hilus is this indented region here. This indented region is the hilus. That's an older term. A more newer term is hilum. But both are okay and exchangeable to use. Again, hilus is just an older term. I'm going to erase that so that I can now go over the blood vessels using this model. First, we see the renal artery. I guess I'll use a different color for this. Renal artery. But you learned that back in Lab Unit 3. After the renal artery, we have, and again, it depends on your textbook, but I'm just going to say lobar artery. And then going in between the lobes is the interlobar. So I should probably tell you what a lobe of the kidney is. This inverted pyramid structure is called the renal pyramid. And this outer region here, shown in the light pink, is called the cortex. Some of the cortex, you can see, goes in between the renal pyramids. And that part that goes in between is called a renal column. A renal column plus the renal pyramid, that entire region is called a lobe. So those are the renal lobes. How many renal lobes do we see in this picture? We see 1, 2, 3, 4, 5, 6, 7. 7 lobes to this specimen, this model. Okay, I'm going to erase this so I can continue on. With my blood vessel discussion. Okay. Okay. Again, some of your textbooks might also describe a segmental artery, and maybe they don't include that term in your textbook, but I'm just going to put it there. They're not interchangeable, segmental versus lobar. It's just that some textbooks include another artery that comes before the lobar artery. Pay attention to what your teacher says that they want you to know. Of course, that's always the rule. Now, after the interlobar, we see these vessels that are arcing around the base of the renal pyramids. So those are the arcuate vessels. There is an artery and a vein. And then after that, we see these finger-like extensions. Those are called cortical radiants. Now, an older term is interlobar interlobular. And I don't like using the term interlobular because it sounds too close to interlobar. So cortical radiant will be what I use for my students. Now, after the cortical radiant, we would have the afferent and then the glomerulus. And this model is too much of a macroscopic model to see those structures. After the glomerulus, it would be the efferent arterial, and then the peritubular capillary or vasa recta, depending on which nephron we're talking about. And I'll address that in just a moment. Let's now do the veins to have the blood exit the kidney. So again, here we see the cortical radiant vein. I'm just going to abbreviate it. We see the arcuate vein, the interlobar vein, and it might shock you to know that there is no lobar nor segmental veins. It just goes straight from interlobar to the renal vein. Okay. Here is another macroscopic structure of the kidney. Again, this is the renal capsule. I'm just going to abbreviate it. This outer layer here is the cortex. And then the inner, deeper regions is the medulla. So the medulla would contain those renal pyramids that I showed you on the previous slide. The nephron, let's address that. There are two types of nephrons that we have in our human kidneys. There is this nephron. Here we see the proximal convoluted tubule shown here in yellow that I'm highlighting over. Then we see the descending limb for the nephron loop, also known as the loop of Henle, the hairpin turn here, the thin ascending limb, then the thick ascending limb. Then we see the distal convoluted tubule. There are two portions to it, the early and the late. And then the distal convoluted tubule connects here through a connecting tubule right here to a collecting duct, to a medullary duct, to a papillary duct. And then this structure is called a renal papilla. And this will allow the urine to drip out of the collecting system. Now, the two types of nephrons that I was starting to speak about, this one has a very long loop of Henle, and this is called a juxtaglomerular. Sorry, wrong term. Juxtamedullary. Too many juxta terms. You'll see why in just a moment. Juxtamedullary. And we have about 15 to 20% of our total nephrons are of that type. They have very long loops of Henle, or nephron loops, that extend deep into the medulla. And these are extremely important to us when we are very dehydrated or have a poor or low blood volume. These nephrons are our water savers. The majority of our nephrons are of this type. Here's the proximal convoluted tubule that I'm highlighting in yellow, the descending limb, the hairpin turn. The thin ascending limb is practically non-existent to the thick ascending limb. And then we have the distal convoluted tubule to the connecting tubule, again to the collecting duct, medullary duct, papillary duct. The majority of our nephrons are these nephrons that have very short loops of Henle, and they're called our cortical nephrons, and we have about 80 to 85% of them. in our kidneys. Now, in this picture, you can also see over here on this side, you can see this web of blood vessels. There's arteries and vein parts to it all around, woven around this nephron. And this blood vessel down here that looks like a fisherman's net around the loop of Henle, that's called a peritubular capillary. Now, peritubular capillary beds are the capillaries around cortical nephrons. Over here, these structures here that I'm circling, those are called vasa recta. They are also a capillary bed, and they are found around the juxtamedullary nephrons. So we have two different kinds of nephrons, and as such, two different types of capillary beds would be around the nephron loops. Vasa recta is to juxtamedullary, as peritubular capillary bed is to cortical nephrons. I'm going to erase this now and show you some more structures using this model before I move on. Actually, no. Actually, yes, I do. Okay. And the structures I want to show you, I'm going to use my yellow pen. Here is our cortical radiant artery coming up. And then we see a branch coming off of it and entering into this yellow renal capsule. So that's the renal capsule, or sorry, glomerular capsule. Don't confuse that with renal capsule like I just did. That's the glomerular capsule. It looks like it's a helmet that fits around this capillary called the glomerulus. So over here, you can see the red glomeruli, which are a capillary bed. And I'll remind you from lecture, that means we have the glomerulus, and then we're going to see the peritubular or vasa recta capillary beds after that. This is a portal system, specifically an arterial portal system. So we're going to see the afferent arterial. That's this structure that I just highlighted. So we see afferent arterial, just put AA, leads to the glomerulus, which then will lead to the efferent arterial, which will then lead to the peritubular capillary bed, or PTCB, or vasa recta, depending on the nephron type, of course. So that's what we mean by a portal system. It's two capillary beds in tandem. Remember, traditionally, after a capillary bed, we have a venule leading to a vein. In this case, we have a capillary bed, which is the glomerulus, leading to another blood vessel, which in turn leads to a second capillary bed. So we see the glomeruli within the glomerular capsule. The two together, much like a football player wearing a helmet, is called the renal corpuscle. So the two of them together, much like a football player, putting their head in their helmet, is the renal corpuscle. Let the player's head represent the glomerulus, and let the helmet represent the glomerular capsule. So to get back to our blood vessel, just again to show you this, here is our blood vessel, our cortical radiant, leading to our afferent arterial. And then inside this renal capsule would be the glomerulus. And then here's the efferent arterial, leading to that peritubular capillary bed shown here on this model. Peritubular capillary bed. Okay, let's move on to the next picture. Here is the afferent arterial again. Here is the glomerulus. It is made of simple squamous endothelium. Simple squamous endothelium. Around it we see these cells that have little tiny feet, well, little tiny extensions that look like feet, and they're called pedicles. And so these cells are podocytes, and their extended little feet are pedicels, not pedicles, pedicels. So that's a podocyte. And its little feet that it wraps around the simple squamous endothelial cells are the pedicels. Podocyte and pedicels are not on your hit list, but I am pointing it out because it was discussed in our lecture. This vessel leaving the glomerulus is the efferent arterial. It has a more narrow diameter, so it's smaller in diameter. And this structure that is coming out at you, that we're seeing a transverse cut through, is the distal convoluted tubule. And you can see convoluted tubule. I'm just going to abbreviate it. Just for the sake of tying into lecture, this technically is the early distal convoluted tubule. And you can see that the afferent arterial and efferent arterial are kind of straddling the early distal convoluted tubule. And it makes a functional contact. We see that the afferent and efferent are touching the early distal convoluted tubule, and together this creates a structure called the juxtaglomerular. I told you there were too many juxtas. Juxtaglomerular apparatus. And that is not on your hit list, but I would expect my students to definitely know this. There are parts to the juxtaglomerular apparatus. There are these cells that are found inside the early distal convoluted tubule. And those are called the macula densa cells. And they are monitoring the salt content in the filtrate at this point, which would be very dilute. But if it gets too dilute, then the kidney is basically going to launch this RAA mechanism that I told you about in class. There are cells in between. There are cells in between the early distal convoluted tubule and the arterioles, and those are called mesangial cells. They have interesting function, but not one that I ask my anatomy students nor my physiology students to know. I do teach about them in my pathophysiology class. Very interesting, and they are definitely involved in disease states like diabetic nephropathy and hypertensive nephropathy. So they are pretty interesting, but a little bit beyond the scope of the class. There are also cells that are associated with the afferent arteriole and efferent arteriole. And it's mostly the afferent. It's very difficult to see here, but I'll try and erase this. They're trying to show you these cells that are they have kind of speckles in them. But these cells here are called juxtaglomerular cells. And there are some that are around associated with the efferent arteriole, just not as much. And the juxtaglomerular cells they are basically pressure detectors. They are a lot like baroreceptors that we have seen in the aortic arch and carotid sinus. They detect when blood pressure is too high or blood pressure is too low as it's coming into and out of the glomerulus. And it's important to regulate the blood pressure entering the glomerulus because you want to have a steady filtrate or filtration rate. You don't want too much or too little because too much can destroy the filtration membrane, and too little means that the kidneys are not adequately filtering your blood plasma. And you'll learn more about that, a little bit about that in lecture for anatomy, and a lot more of that in physiology. Now, what about these cells here that are part of the glomerular capsule? Those are simple squamous epithelial cells, and they are considered to be the parietal layer of the renal corpuscle. And the podocytes are considered to be the visceral layer around the simple squamous endothelium of the glomerulus. Down here, we see simple cuboidal cells. Simple cuboidal cells. And this structure is the beginning of the proximal convoluted tubule. Okay, that was a lot on that slide. And here are the, this model actually has all three of these structures on it in our lab. So we see the macroscopic kidney, and then we're starting to get more microscopic and then progressively more microscopic when we get to the actual renal corpuscle. So this is the renal corpuscle. It has the glomerular capsule. I'm just abbreviating. We can see the glomerulus. And then here, these little nuclei, and you can see the pedicels. Those are the podocytes. They are part of the filtration membrane. And here is the proximal convoluted tubule. Down here we can see the vasa recta. This net-looking structure is the peritubular capillary bed. Here we see a juxtamedullary nephron, and this is a cortical nephron. So we're starting to see things come together. Oh, over here is our early distal convoluted tubule, the part of the distal convoluted tubule that is in contact with the afferent arteriole, and here's the afferent arteriole, which is bigger than the efferent arteriole. Okay, some other structures that I want to point out on this larger kidney model are the major and minor calyces. This structure that I'm highlighting in green, coming off of the renal papilla for each of the renal pyramids, this structure that I'm filling in, it's called a minor calyx. Plural would be minor calyces. And all the minor calyces basically dump into larger calyces. which I'm highlighting and coloring in purple now. And then the major calyces all merge into this trumpet-shaped structure that I'm coloring in light blue, called the renal pelvis. And then the renal pelvis is continuous out of the hilum as the ureter. So this is the ureter. And it would go to the bladder where urine would be stored temporarily until socially acceptable to void. So I'm not going to go through all of these structures. I am going to make a little few corrections for my class at least. This part up here in the cortex, I want my class to know that part as the collecting duct. And this part here that is traveling through the medulla, where we would find the renal pyramids, of course, I want my class to know that as the medullary duct. And then lastly, this structure down here that is actually exiting out of the renal papilla, this is the papillary duct. Other than that, all of the structures here are labeled correctly. Here is our abdominal muscle, and we can see this cream structure here. That's the ureter. And then down here, we can see it leading to the bladder. Here is another model showing you the renal system. We can see the kidney. We can see on top of it the adrenal gland. Everything that's labeled here is correct. We can see our renal pyramids. We can see the renal cortex. Again, I'm just abbreviating. The renal pyramids would be the region where we find the renal pyramids would be the medulla. So pay attention to the question. If we point to a renal pyramid and say, name the structure, you would say renal pyramid. But if we're pointing to what looks like a renal pyramid and the question says, name this region, then you should say medulla. Here is our ureter leading to the bladder. The bladder has these macroscopic folds called rugae. And the purpose or function of the ureter obviously is to transport urine to the bladder. And the purpose of the bladder is to temporarily store our urine until we go and excrete it. We go to the bathroom. We have the urethra down here. And the urethra, its function is basically to provide a passageway for the urine to empty from the bladder to the outside of our body. That is the only purpose. And here's an up-close picture of the bladder. We can see the rugae. This smooth part here, where you don't see any rugae, is called the trigony. And these holes that you're seeing here are actually the holes for the ureter to enter. Now this structure that is going in between the ureter and the bladder, this is actually a model from a male. And that structure is called the Ductus Deferens. Also known as the Vas Deferens. And the joke that I like to say now is, what's the difference between a man's bladder and a man's ureter? Do you know? I assure you there's a Vas Deferens. Anyway, I know that's corny, but hey, it works. So if you see a structure going in between the bladder and the ureter, it is the Ductus Deferens, also known as the Vas Deferens. And then down here, we're seeing the urethra, but specifically, we're seeing the prostatic urethra, because this structure here in purple, maybe I should highlight it in a different color, is the prostate. Okay, I have covered everything. The function of the glomerulus, just to state what that is that's where filtration occurs. And renal pelvis, I covered all that. The nephron, the function of the nephron. This is where we have the filtration, the reabsorption, the secretion. The function of the afferent arteriole is to bring blood to the glomerulus, and it helps regulate blood pressure within the glomerulus. The same thing can be said for the efferent. It also helps with regulating blood pressure in the glomerulus to allow for a constant filtration rate. And it also drains blood from the glomerulus. The function of the peritubular capillaries and vasa recta are to bring in the reabsorbed sodium, glucose, extra water that has been reabsorbed by the nephron, bring it back into the circulatory system. Okay, so these pictures here I give you so that you can practice with them. They are just basically unlabeled structures. It's basically everything redundant again. Okay, let's move on to the respiratory system. Some of these structures in the respiratory system will also apply for the digestive system. For example, in the digestive system, you learned about the different regions of the pharynx. So we're going to do them again. Let's start with the regions of the pharynx. This region here, behind the nasal cavity, is the nasopharynx. It is an air passageway. And from the soft palate, basically to the hyoid bone, which is right there, is the oropharynx. Its purpose is to be both an air passageway and a passageway for food that you have swallowed. And then lastly, from the hyoid bone to roughly the level of the cricoid cartilage, roughly, is the Larengo Pharynx. And its purpose is to be both a passageway for air and food. This tube posteriorly, I'll color it in green, this tube back here is the esophagus. And then this area up here that I'll color in purple is the larynx. And then it continues posteriorly as the trachea. Or I should say, sorry, it continues inferiorly as the trachea. Excuse my language. Okay, so this area is the nasal cavity. And here is the hard palate that I'm putting in purple. And then this is the soft palate that I'm putting in green right now. Then, let's see, so that's soft palate. I'm just going to abbreviate. Otherwise, this video is going to be 4 hours long. Hard palate. This open hole going through your nose, basically into your nasal cavity, those are your nasal nares or external nares. The function of the larynx is to be an air passageway. One cartilage of the larynx, the epiglottis that you will see here, this epiglottis, is considered to be the airway guardian, meaning it helps route food. Food should go into the esophagus and only air should go into the larynx. So that's another function of the larynx, is to regulate the air coming into the larynx and trachea versus food. And on another model, I will be showing you the different cartilages of the larynx. So let's do that now. Here we go. So we're looking at the posterior larynx. We're looking at a posterior view. And this is just showing you the cartilage. It doesn't show you the mucosa. This is the epiglottis. It is made of elastic cartilage. These are the tracheal C-rings. They're not called O-rings because they don't go all the way around. So they would be curving anteriorly and ending posteriorly here. Cartilaginous C-rings. They are not part of the larynx. They are support structures of the trachea. I'm pointing it out because they are made of hyaline. This muscle that's in between the cartilaginous C-rings is called the trachealis. Not cartilage, but I'll just point it out. This is the hyoid bone. This cartilage here is the cricoid cartilage. And this large cartilage here that I'm highlighting now is the thyroid cartilage. Okay, then these that I'm highlighting in green, those are the arytenoid cartilages. Excuse me. And then the tiny little horn-shaped cartilages that are on top are the corniculate. Okay, now here is the anterior view. Again, we see the hyoid bone, the thyroid cartilage, with the laryngeal prominence, in case you want to know about that, or Adam's apple. Here's your cricoid. And here are two C-rings around the trachea. Now we're looking at the inside of the larynx, and just to give us some perspective again, down here we actually have the trachea. This is the thyroid cartilage. Here's the cricoid. I'm just going to put C for cartilage. And then this structure up here is the epiglottis. Come on. Let's just get rid of that, shall we? It's in my way. There we go. Epiglottis. Now you can see this structure here I'm circling around. It's in white. Your true vocal cords are white because they are avascular. That means they don't have a blood supply. But up here that I will circle in green, we're also seeing some folds in the mucosa, and those are called your vestibular folds, also known as your false. And just to draw false vocal cords, just to draw from lecture, those vestibular folds, even though they are not producing sound, they are very important with the Valsalva maneuver, which is where you take a breath in, much like you do when you're defecating, and then you're trying to exhale on what we say is a closed glottis. So those vestibular folds kind of push over the vocal cords and they trap the air in your trachea. And when you're doing this maneuver, holding breath and bearing down, this allows you to create more intra-abdominal pressure and help expel your fecal material. But the Valsalva maneuver is also used temporarily when you're coughing. It's also used by women who are birthing a child. Okay, so let me just make sure. The other cartilage that is not on your hit list, and it would be found wrapped up in those vestibular folds, in case you were looking for them, are the cuneiform. So they're wrapped up in the mucosa. Just again to draw from lecture. Now moving on, we have the trachea. We have the left primary, that's what that one with the little circle, primary bronchi. And we have the right primary bronchi. And then on this model, we can see secondary bronchi. So those branch off the primary. Okay, and then we would see tertiary bronchi, which is not on your hit list, but just to draw from lecture. And then we're getting into smaller bronchioles. We're starting to get into that bronchial tree. Bronchioles. These little hexagonal, polygonal structures that you're seeing on the surface of the lung can be seen with the naked eye, and those are called lobules. All right, and now let's go on to the lobes of the lungs. We can see that best here. Okay, so the lobes of the lung, we have 3 lobes on the right lung. So this is the right and this is the left. And we see fissures. Both lungs have an oblique fissure. The right lung also has a horizontal. So both lobes, or both lungs, sorry, would have a superior lobe. Excuse me. I'll just put an S for the right superior lobe. The right has a middle lobe, and then obviously both are going to have an inferior lobe. The left lung has this cardiac notch. Let me see what else is on your hit list before I move on. Forget something. So we did the lobes, we did primary, secondary bronchi. I did the function of the trachea, which is an air passageway. Told you about the trachealis. All right, so we are moving on, almost finished with this. Okay, let's move on to this picture. Now, this space that I'm coloring in green is the pleural cavity. And tightly adherent to the surface of the lung that I'm drawing in light blue would be the visceral pleura. And tightly adherent to the underside of your thoracic cage with the ribs and the external and internal intercostals that I'm drawing in purple would be the parietal pleura. So again, pay attention to the types of question. We might say, name this space around the lung. You would say pleural cavity. If we said, name this layer on the surface of the lung, you would say visceral pleura. If we said, name this layer under the thoracic cage, you would say parietal pleura, just to give you an example. Okay, this next picture is again a up close picture. We could see the trachea. This is now becoming redundant. I've covered all this. This is a primary bronchus. Here are secondary bronchi. These would be tertiary, which are not on your hit list. In red, just to remind you, those are pulmonary veins going back to the left atrium carrying oxygen-rich blood. And in blue are pulmonary arteries. Don't confuse those. And then this structure here is the esophagus. And we can see it exiting through the diaphragm, through the esophageal hiatus. This structure here is part of the diaphragm, which is the prime mover for respiration. You should remember that from Lab Unit 2. Okay, and then our last slide again is just showing you those polygonal structures called lobules. We can see the different lobes of the lungs. The right lung has those 3 lobes. It's got superior and inferior, but it also has a middle. It has the horizontal fissure seen here, and then a part of the oblique fissure we can see there. Down here we see the diaphragm. And then again the cardiac notch of the left lung, cardiac notch. And all right, I have gone through all the structures for renal and respiratory hit list for Lab Unit 4. Thank you very much for listening.